Yeah.
Okay, now we've done your pre-questionnaire. So now I'm going to check you for your ab separation. Okay, so is it okay if I touch you?
Yeah.
Yeah? Okay. So do you know what is ab separation?
No.
No? Okay, so you know when you had your baby, okay, your core muscles, there are 4 layers. So you have the rectus abdominis, which is the front muscle that runs down here. Then you have your external obliques, which is on the side. And then your internal obliques, and then your transverse abdominis at the bottom. So there's these 4 layers. So as the baby grows, the muscles will stretch and stretch and stretch until they cannot stretch anymore. So you have this connective tissue that connects the muscles in the middle down here. So there's a linear elbow. It's called the linear elbow. So it's down the middle down here. So that part will might actually stretch until it kind of tears apart. So it moves to the side so that the baby can go out to the front. Okay, so there's the connective tissue that is pulled apart during pregnancy. Yeah. So today we will check for that. So okay, I think more or less your clothes are okay because it's quite thin, so it's fine. Yeah. Alright, so I'm just going to place my fingers onto your stomach. If you want, you can cross your hands across your shoulder. Then you're going to bring your knees up towards the ceiling. Yeah, so just keep feet flat down on the ground. Alright, so knees in line, so not falling out to the side or caving in. It's good. Alright, so I'm just going to check one position first on your, just slightly above your belly button. Okay. Alright, now I'm just going to roll your head just a little bit off the ground, but you don't brace into the core. So just lift, just tuck your chin to your chest just a little bit. Don't need to come up too high. Just a little bit too high. And come down a little bit. It's not like a sit up, just a slight hip lift off the ground. Alright, okay, you can lie back down. Okay, I'm going to check you up a little bit higher. Just around catch you. Okay, I can lift your head up off the ground. Alright, and then the last one, you just go down a little bit lower. Okay, might be a bit ticklish here. Okay, and come off the ground. Just a little bit lower. Remember not to brace around the core. Okay, try one more time at the bottom. Just lie down. Okay, slight head tilt. And gently down. Alright, okay, so it seems that you have like about 2 finger separation, so that's not too bad. It's quite normal to have a separation in your abs. It happens to almost all moms. So the important thing is that we want to rebuild you from the inside out. So instead of doing all these like sit-ups that work the external core muscles, which might actually be more damaging, we want to start off by working the inner core muscles, so your true core muscles, the ones that's like the innermost layer. So start on that first before we work on to your rectus abdominis and maybe your obliques. Okay? Alright, so next up we're going to move on to your pelvic floor. So, you know what's the pelvic floor?
No.
No? Okay, so those are the sling of muscles that actually hold up your bladder, your rectus, and your uterus. Okay, so during pregnancy, this muscle that holds it up might actually weaken because there's so much weight and pressure from the baby on these muscles. So you're just going to try to learn and activate that muscle, okay, during your exercises.
Okay.
Alright? Okay, so I'm just going to place my hands on you. So how you're going to set up is to just lie down your head to the ground. If you want, you can close your eyes as well too. You can just relax. So shoulders nice and relaxed to the ground. So try to even out the shoulders. Hands by the side. Okay, same thing, feet on the ground, knees up. And then just going to have a natural curve in that lower back, but don't like let the chest protrude out to the sky. Okay, so just tuck it in a little bit if it's sticking out. Okay, it should be just a natural curve. So don't need to stick the lower back down to the ground. Okay, just nice and relaxed. Alright, okay, so I'm going to place my hands onto you. So I'm going to place one of my both my thumbs on your transverse abdominis, which is at the bottom, and then your obliques, which are on the side. Okay, so if you move yourself side to side, or cough a little, maybe, okay, you should be able to feel these muscles. Do you feel this down here on the side? Okay, the other hand's going to be on your transverse abdominis at the bottom here. Okay, so remember for this exercise, it's kind of like only 5% of what you usually think you are doing in your normal like sit-up or crunches, so they kind of burn. You won't really feel that. So it's not that kind of very crunching or bracing or very strong movements. Okay, so can tell that you are from what I can see will be compensation in your obliques and your transverse abdominis if you are doing the exercise wrongly in a sense.
Okay.
Yeah, so if you I can't really tell because it's an internal muscle whether or not you're using it correctly, but I can tell if you are using other parts of the muscle to overcompensate. Yeah, so it's more of seeing what I cannot see something, so I'm trying to look at other things to try and see that portion where it's working. Yeah, okay. Alright, so you're gonna just take a natural breath in and then exhale all the way out. Alright, then you're gonna think of drawing that front passage up towards you. Okay, so yeah, you know where you pee out from. So that part, you're going to think of like, okay, let's think of if we are like peeing, then you want to stop yourself from peeing. Okay, that muscle, okay, try to connect to that muscle. Alright, okay, I can feel you activate your transverse abdominis here. Alright, just now when you're doing that.
Right.
Okay, so we try not to use either this or this. Alright, it's just the internal muscle at the bottom. Alright, okay, so another way you can think of is like if there's a tampon inside you, and then you are like squeezing the tampon and lifting it up. Alright, another cue would be it's more of like taking a tissue paper out of the box. So it's not a like kind of like movement. It's a very gentle, like you have to pick and lift. And then it's not lifting like pull until all the way to the top. So it's just a gentle pick and lift and then relax. So you also can think of it like a jellyfish kind of movement. So you lift, so this is the contraction part and then the relaxation part.
Right.
Okay? It helps if you are like sitting down or maybe on a ball. Okay, or you can think of it like put your hand in between your legs, you know, that part, and you're going to lift that part up towards you. Just a very gentle, soft motion. Okay? Alright. So just now when you tried it, you actually activated a little bit on your transverse abdominis. So you try not to activate it, but just a very small movement at the bottom. Everything down here should be disengaged. Alright, let's try it again. I'm going to take a natural breath in. So exhale all the way out. Alright, let's try that small, gentle lifting, just 5%. Good, I didn't feel anything at all. And then relax. Okay, so importantly is both the contraction and you also must learn how to relax the muscle as well. So both contract and release. Right, I'm going to try one more time. Okay, inhale and exhale out. And as you exhale, you're going to think of the tampon in there, just gently lift and pull and then release. Okay, so it's not towards your bum area, you don't want to squeeze the bum in any way, it's more front passage only and lift. Gentle lift up. Okay, just a gentle lift up and then relax. Good, I didn't feel anything. Just a little bit at the start, but then after that, only the first one. So the last two, not really. So, you think you got it?
Yeah.
Yeah, you can feel it.
But it's not also like connected to the...
Actually helps you be continent, meaning that you can pee and stop. Yeah, so that's the muscle that helps you stop you from pee. And so people who have weak pelvic floor, then they will experience things like leaking or like even their other muscles like their uterus or their bladder falling through the vagina and coming out of the body. So if you have a very, very weak pelvic floor, then this kind of things can bound to happen.
Why shouldn't the transverse abdominis be
activated?
Yeah.
Alright, okay, we're moving on to that. So that is the second part, okay? So now, I mean, you can do it together. They actually do work hand in hand, but then I think maybe learning one thing and then the other and then adding it together is easier than just because you could be activating the transverse abdominis and then actually you don't know how to engage the pelvic floor. So teaching it separately and then putting it together is probably like more bite-sized for you to understand. Yeah, so at least I know like now without you working this actually yes, you do know how to work your pelvic floor now. Yeah, so, and then now we can put it together. So, but then next up, we'll do the transverse abdominis next, okay? So those are your lower calf muscles. They run horizontally. So along your lower, if you wear like low undies. So low undies around this portion down here, across the bottom. Right, so this area. So I'm going to put my hands on you on the same time, same again. And then same thing with the pelvic floor. It's also just like a 5% activation. So when I tell you to suck, like really brace and like become very strong like you would do in your normal like ab exercises. So no, not this one is just more of an activation. So awareness in that muscle only, in just this part. Okay, so we're going to try to activate just the transverse abdominis and not the obliques. Okay, personally, I find it a bit hard to activate the transverse abdominis without activating the obliques. Actually, it's a little linked together. So, but then with a little bit more awareness, we can try to just activate just the transverse abdominis alone. Okay, alright, so same positioning. I think you're all good. Hands by the side. Same thing, you're going to relax the head. Okay, relax the shoulders down to the floor. Natural curve in your lower back, and then let your knees are good, feet flat on the floor. Okay, I'm going to place my hands again on you. You want to try place one hand, you want to try yourself. Okay, so I guess I find it easier. So usually we will place one hand on the lower part and then one hand on the side, so that you can feel both your obliques and then as well as your transverse abdominis. Okay, maybe you try that a bit later first. Okay, I'll just check it out for the first time. Okay, so you're going to just take a natural breath in and then exhale all the way out. Alright, now you're going to think of pulling the skin on your undies away from the undies. Okay, so just think that the front part of your undies here is really hot and you need to pull away from it.
Pull in.
Yes, pull gently in, so it's not a really sucking motion. Just going to activate the muscles. Pull from hip bone to hip bone, pull that muscle down, and then pull it back towards your tailbone area. Right? Okay, a gentle breath in, and then exhale all the way out. Alright, pulling the skin away from undies, not activating this part, just this part, gently down, and then relax. Alright, I'm going to try again. I actually didn't really feel anything, so maybe like a little bit more activation. Maybe that was like 2.5%. So maybe let's try a little bit, 5%. Try to activate this part here where my thumbs are at, okay? Inhale in, exhale out. And gently pull the skin away from the knees. I think you're pulling it slightly higher up on the top one here. Okay, so this is actually like the typical Pilates move. They think belly button towards the spine. So over here and then suck down, keep the belly flat, right? Okay, you want to try to do that, but the second cue for you would be think of the belly button being slightly lower. So somewhere around your low undies line, and you're going to draw it together and then down. Okay, so slightly lower in this portion rather than up here. Alright? Okay, let's try again. Inhale through your nose, and then exhale out. And then gently pull the skin away from your undies, or a low belly button down to your tailbone. Good. And gently release. Alright, you feel a little bit more activation here?
Yeah.
Okay, I didn't feel anything on your obliques, so that's good. No activation here at all. But down here, yeah, I can feel a little bit of a tensing motion and then down and flatten towards the side. So usually what happens when we do this kind of like lower ab exercises, you see that bulge in front down here. When you crunch up and then you only see this is actually just your rectus abdominis that's working, and then you will see that this part bulges out in the top. So when you activate your transverse abdominis, you actually realize that this part can actually help you to flatten down. Yeah. Alright? Okay, so that's your transverse abdominis. So now we're going to move back to the ab separation again, but I'm going to check you while you activate both the combination of your pelvic floor as well as your transverse abdominis together. Okay? Alright, yeah, maybe prefer you to cross your hands back over to your chest, just move it out of the way so that we can check again. So same thing, no bracing, just gently lift and roll the head off the floor. Alright, so but before we do that, you're going to take a natural breath in and then exhale all the way out. Alright, and then gentle lift. Okay, pull that through and then it's very nice, good. Okay, pull and gently pull the skin away from the undies, then roll the head off the floor, just a slight roll. Very good. And gently go back down. Then we're going to the second spot up here. Very good. I saw a nice activation on your transverse abdominis. Good. Alright, let's try again. Inhale and exhale. And then gently lift and pull that tissue paper through the front passage. Pull the skin away from the undies. And then you can roll the head off the ground. Good, very nice. And then I'll check you down at the bottom one last spot. Get ready. Take a natural breath in. And exhale out. Alright, pull front passage up. Gentle lift, 5% only, and then pull skin away from the undies. Pull up. Very nice. And gently lie back. Alright, okay, so I think with the activation you can see that there's actually a slightly smaller gap. So there's a nice tension in your linear elbow. So it seems that there's still quite a good connection between both the muscles. You can just probably work on, like there's a little bit of more depth, but you can probably work on that so that the depth, like there's more tension and there's less depth in the linear for that one. Okay, so I think the last big point that we can go through is the working with women's health physiotherapists. Okay, so do you know what's that?
No.
No. Okay, so in Singapore you can there's one called physio down under. Okay, they're not super cheap. It's maybe like 200 plus per session, but it will be good to go to them for initial assessment because as I said, it's internal muscle. Okay, the transverse abdominis you can more or less see, but for the pelvic floor especially, those are internal muscles that we cannot see as a trainer, and it's not within our scope to go you down there. So their job is to check, and what they have is also it's good to go to one that have a real-time ultrasound. So with the real-time ultrasound, they actually can scan and you actually can see your pelvic floor. So you can build that mind and muscle body connection. So now it's like I can't really tell, okay, I can tell, okay, if you are overcompensating, but I can't really tell if you're super activating it correctly. And especially for pelvic floor, some people can be actually doing the opposite motion, which is to bear down on their pelvic floor, which could cause more damage. So some people think that they're actually pulling it in and up, but actually they are pushing down on it instead. Like when you are sucking or like bracing or what, you actually could be pushing down on your pelvic floor rather than strengthening and lifting it up. Yeah. So with the real-time ultrasound, they can actually help you build that mind and muscle body connection, and they actually can touch and feel in there to see what is the health of your pelvic floor. So it's really important. I wouldn't say like I can't work with you if you don't go to one, but whatever information that they pass over to us is very insightful, and then we can work together with them. So it's more of like a collaboration and a co-working together, so that we both together can work to provide, I mean, to work the program that is best for you. Yeah, without her knowledge, then I only can have so much to work with to design a program that is the best for you.
Okay.
All right.
Thank you.
Thanks. Okay, we're done.